Hello everyone and welcome to another short primer video on pulmonary function tests. Now those PFTs are used very commonly to diagnose pulmonary pathology, and you need to correctly interpret all these values. So let's get going. Now during a pulmonary function test, the patient is asked to take in as deep of a breath as they can and then blast out that air into a tube as fast as they can and then attempt to empty their lungs until they feel like they're about to pass out. And then we get some really important data from this. Now, two of the most important measurements are the FEV1 and the FVC. Now, the FEV1 stands for forced expiratory volume in 1 second. So this is how much air a patient can blast out in 1 second after that full inspiration. Now, the FVC stands for forced vital capacity. So this is the volume of air that can be forcibly blown out after full inspiration. So this is that total amount of air that a patient can get out. And often these measurements will get displayed on a graph. So let's look at some of those. Now on these graphs we see lung volume on the y-axis, and then we have time after exhalation on the x-axis. Now the numbers may not be entirely accurate here, but for our purposes it's going to be good enough. Now on the left side we see a normal graph. The patient is able to take in maybe a little over 6 liters, and then in 1 second that patient is able to expel or blast out about 4 liters. And then ultimately he or she is able to get out a total of 5 liters. So the FEV1 is about 4 and the FVC is about 5. Now, a very important ratio is the FEV1 to FVC ratio. Now, normally the ratio should be about 80%, and that's what we see here in this normal patient. Now, next let's move on to the obstructive lung disease patient in the middle. So examples of obstructive lung disease include things like emphysema and asthma. Now, probably the first thing you'll notice is that the total air volumes are larger. There is more air in the lungs at any given time. Now, the whole graph is shifted up. Now, why is this happening? Well, this is due to air trapping. Patients who have obstructive lung disease can't get rid of their air very well. And here we see that graphically. Now, both the FEV1 and the FVC are decreased, but the ratio has also shifted. The FEV1 here is about 2, and the FVC is about 3. So that puts our ratio at about 66%. So in obstructive lung disease, the FEV1 to FVC ratio is usually less than 80%. Now take a very close look at that. And again, this makes sense. If in general you can't get rid of your air in an obstructive lung disease problem, then you won't be as effective at blasting out a great volume of air in that first second. So for obstructive lung disease, you see high volumes but lower FEV1 to FVC ratio. Now next we have the restrictive lung disease on the right. What do you notice first? Well, just like the obstructive lung disease, the volume is abnormal, but in this case the lung volumes are decreased. This makes perfect sense because in restrictive lung disease you can't fill your lungs very well. Think of a very obese patient or a patient with sarcoidosis. They physically can't get as much air into the lungs. Now what's the next thing we should notice? Well, let's look at the FEV1 to FVC ratio. Well, with restrictive lung disease, the FEV1 to FVC ratio remains closer to normal and sometimes even elevated. In our example, it definitely looks like it's greater than 80%. Now, don't get confused by this because both the FEV1 and the FVC overall are decreased, but they are decreased proportionately. So the ratio stays pretty close to normal or elevated. Now, if the question asks about the absolute values of FEV1 and FVC in the restricted lung disease patient, then the answer is that they are both decreased. But again, the ratio is going to be close to normal. Okay, so that's the most important step that you need to know regarding pulmonary function tests. I hope you learned something. I'll see you next time.